Hello friends, today we are going to see about cerebrospinal fluid, which is also called as CSF. In this, we are going to see about what is CSF, how it is formed, then its circulation, absorption, functions and clinical anatomy. First, CSF is a modified tissue fluid and it is contained in the ventricular system of the brain and also in subarachnoid space around the brain and spinal cord. Next, we see about the formation of CSF. The CSF is formed by choroid plexus of lateral ventricles and the total quantity of CSF is just 150 milliliter. The normal pressure of CSF is 60 to 100 mm of CSF or as water. Then we see about the circulation. The CSF passes from lateral ventricle to the third ventricle through the interventricular foramen, that is also called as interventricular foramen of Monro. Then from the third ventricle to the fourth ventricle, it passes through cerebral aqueduct. Then from the fourth ventricle, the CSF passes through the subarachnoid space through the median and lateral apertures of the fourth ventricle. So this is the pathway of the CSF which is described in this flow chart. Next we see about the absorption. CSF is absorbed through the arachnoid villi and also granulations. Then it is drained to the cranial venous sinus. Then the function of CSF, it decreases the sudden pressure or force on the delicate nervous tissue. The nervous tissue which is so small and very delicate, so it decreases the sudden pressure and acts as a cushion for that nerve. Then it nourishes the nervous tissue because the blood can't directly come in contact with the neurons, so it provides nourishment and returns products of metabolism through this venous sinus. Then we see about the important energy supplier, that is glucose and oxygen is constantly provided by the CSF to the neurons because the neurons can't live without glucose and oxygen for 3 to 4 minutes. So our CSF is constantly providing glucose and oxygen to the neuron. Then we see about the transportation, that is the pineal gland secretion reaches the pituitary gland via our CSF. Then already we know about this, the CSF also has a cushioning effect. So the major function of the CSF is to cushion the brain within the solid vault. Then we see about the clinical anatomy. So clinical anatomy, we have to mainly see about hydrocephalus. It is the dilatation of the ventricular system which occurs due to the obstruction of CSF. So it is of mainly two types, that is communicating and non-communicating. In communicating means the obstruction is outside the ventricular system. So usually in the subarachnoid space or arachnoid granulation. So it is called as communicating. If the obstruction is within the ventricular system, then it is called as non-communicating. Then we see about the lumbar puncture. So the lumbar puncture is the easiest method which is commonly used to obtain our CSF. So it is done by passing a needle in the interspace between the third and fourth lumbar spines. Thank you.